As hospitals across the country focus on tackling this pandemic, people with other illnesses are left waiting in fear. A lot of people are avoiding going to the hospital, or they're choosing to get treatment at alternative outpatient facilities. So we want to talk about that. We're going to bring in Dr. Ryan Lamb. Doctor, you're an emergency medical physician in North Carolina. And, I can totally understand why people would want to avoid going to hospitals. And often they're being told to sort of, if you don't need, even before, if you don't need to go to the emergency room, don't. But I think there's even a concern about going to urgent care facilities, or even maybe going to some of these testing facilities to maybe get some routine tests you had scheduled, because who else is showing up there to get tests? So my first question for you is just advice for people who think they need some sort of medical intervention, but they're afraid to go to the ER.
My first recommendation is that I think we have gotten to be very safe. We've learned a lot in the virus over the last couple of months, and learned that with both distancing and masks and washing our hands, we can protect people. So I think the emergency department is safe. We've been seeing patients for over a month, and none of our staff has gotten the coronavirus or COVID-19. So I think that that's probably the most important message, is that it is safe to come in and get seen. But if you're looking for alternatives, I think there is virtual care, there are urgent cares, and then of course the emergency department. Trying to decide when to go, I think, is a difficult message. And I think people are making the mistake sometimes of waiting too long and missing that critical timeline when we can make a very good intervention and help people.
So I guess perhaps for a lot of Americans, the perception was that our medical professionals like yourself are overworked and under pressure and straining because of the rise of this pandemic and where we are today. So it's wonderful news to hear you say at your hospital in your emergency room that everybody is safe and healthy. That's really, really wonderful. But does that also mean that the system, and I know we're specifically talking about yours, but I guess overall the system has not been taxed by the pandemic? Because in places like New York City, it does certainly feel as if our medical professionals here are under enormous pressure, and perhaps the reason why the governor in this state suggested that people put off surgeries that are elective was to sort of relieve that pressure. But is that perhaps not the case across the country?
I think that we needed to slow everything down and to try to flatten the curve. Absolutely, that was an important process. We also needed to slow the same thing. We slowed down elective surgeries here, and we got prepared for the worst. New York was certainly hit much harder than everyone else that we see, and a lot of condensed areas had the same problem. But now that we have slowed things down enough, the hospital systems and the emergency departments in general across the country are not overwhelmed, and in fact seeing mostly 30 to 40% reduction in volumes. So we have plenty of capability of taking care of people. If we completely remove the processes that we've been doing, then we are going to see an escalation of patients and can run into the same problem again if we're not following the guidelines of distancing and wearing masks and washing our hands. But at this time, that's not the case, and we're seeing a lot more both deaths and comorbidities and illness as a result of people not seeking care.
All right,
That's
so
important.
we are learning that, yeah, it's really important. As a result, some elective surgeries are being rescheduled. We had read reports about some hospital staff being laid off because they were hospital staff that participated in elective surgeries, and without them, they weren't required to be there anymore. So that's changing, though, in some areas that are not dealing with, a major outbreak of the pandemic. But what's an elective surgery going to look like now in the era of COVID-19?
I think there's going to be a little more scrutiny in terms of making sure your health as well as the staff's health. So the American Hospital Association has come up with some guidelines to try to help people run through that process, of which you're going to need testing, so the patients are going to need to be tested. There's going to be a need for plenty of PPE or protective equipment for both the staff as well as the patients. And then deciding who needs to go first in terms of acuity and severity of their problem. But our hospital system is starting to work on the process of when we will initiate elective surgeries again, and I think it will be soon.
Doctor, there are a number of Americans who don't have a primary physician and rely on urgent care for treatment. Do you see any consequence of people relying specifically on urgent care facilities? And are there consequences for sort of mass numbers of people avoiding hospitals because of that?
Yeah, I think number one, I think a primary care physician is important, someone who knows you and can follow you. It puts more of the work in the person if you're going to choose to do care outside of regular routine care where they know you and have established care, because then you need to follow some of those own problems yourself. And then when it comes to people not seeking care and the consequences of, Times had an article yesterday that showed the death toll has increased from 112 to 325% above baseline. And that's certainly a lot more than the coronavirus alone. And so if we're not getting people in and getting them seen in that critical timeline, then we can't do interventions and treat people like we can for strokes and heart attacks and appendicitis. And the whole support system of both the urgent cares, the primary care doctors, and the emergency departments all play a role in that.
I think you sort of made a really good point
go ahead.
earlier about the. Go ahead, Vlad. I was really just going to say that about the fact that, all hospitals are not the same. All regions are not dealing with the same level of crisis, and that, where you're at, the crisis is managed and manageable. I really wanted to know how you were holding up and how your team's holding up in the midst of this.
Yeah, thanks for asking. We're doing well. Initially, there was a lot of fear, a lot of stress that we wouldn't be able to be protected, and is just not knowing how to treat the illness. But a lot of people in New York particularly has been able to give us a lot of education so that we know how to treat the patients, how to protect ourselves, and then how to, both prevent the illness as well as just prevent general disease in ourselves. And we focus on wellness, and we have Wellness Wednesday for our group to share things that we're doing to keep ourselves happy and our families happy.
That's good news, and we wish them well. We wish you well, Dr. Lamb, and we appreciate all that you do in keeping us safe as a community, as a country. Thank you very much.
Thanks for your time. I appreciate it.